Dr. Shelly Rubin is the immediate past president of the American Heartworm Society, a society that gets together to discuss heartworm disease. It doesn't sound good.
Amazing, isn't it?
Yeah.
That so many people would be so interested in such a little parasite, right?
What is heartworm?
Well, heartworm is a devastating disease, Steve, and it affects dogs, cats, and ferrets, and a lot of other mammals, coyotes in the world. But it is a microscopic parasite that's transmitted by the bite of a mosquito. And that little microscopic larvae travels through the blood of the dog, or the cat, or the ferret, and ends up in the heart, or the vessels that supply the lungs. Grows to about 12 inches long. And in severe cases, in a dog, for instance, you could have somewhere between 50 to 100 worms clogging the arteries and the heart.
That doesn't sound good. Imagine they're spaghetti-like things.
They look like spaghetti. That's
all wound around the heart, 50 of them.
Inside the heart and the vessels that supply the lungs. So it's extremely devastating in severe cases. And yet it's so easy to prevent. And that's what's so difficult for us as the American Heartworm Society, is no matter how much we try to get the message out that the disease can cause death, it's a serious disease. Prevention is so effective, and that means either monthly topicals, orally, or even an injectable for 6 months, that why don't people do it? And it isn't because it's that expensive to do.
Well, why don't people do it?
You know, we're not sure, because it's a behavior. It's like human behavior. You know, I talked to a human physician friend of mine that's up high in the American Medical Association, and he said exactly the same thing. You know, you go to your doctor, you get antibiotics because you're sick, you feel better in 2 or 3 days, and you stop the antibiotics. I mean, people do this with their heart medicine. You know, they have chronic heart disease, and they go and they take their medicine, and in 3 weeks they feel great, and they stop their medicine. So we have the same problem with our pets.
Okay, so they don't, several things here all at once. Sometimes you don't think it's going to happen to you. You don't think it'll happen to your dog or cat. Or maybe for cats, my cat's mostly indoors. Well, mosquitoes come indoors.
Right, and the other thing in the United States is that we have multiple microclimates around the United States. So in the northern parts of the United States, where everybody doesn't think about mosquitoes in the winter, mosquitoes winter over. There are microclimates inside houses where mosquitoes live. There are several species of mosquitoes that will live with very little water and will, you know, and can survive. And if they're carrying heartworm, your pet can get infected. It only takes the bite from one infected mosquito to cause heartworm.
And here's the fun news. Mosquito populations in some parts of the country
are rising.
Yeah.
Yeah, very much so.
What's with that?
You know, people think, oh, there's no mosquitoes in, let's take Las Vegas as an example, or Arizona, in areas where they have built up, put into the desert golf courses and big communities where there's irrigation and water, and we have mosquitoes. And what's the copulation that carries, what's a reservoir for heartworm? The coyote, great reservoir. So a mosquito bites the coyote, then goes and bites your dog or your cat, or if you have a ferret, you know, bites your ferret,
yeah,
or other mammals, and then that animal will get heartworm disease.
All right, so let's talk a little about prevention. It's necessary because, actually I want to talk about treatment, because treatment, if price is an issue, treatment is much more the price in dogs. And tell me about the treatment in cats.
Well, first of all, in dogs, we know the treatment involves using an arsenical drug. It's an arsenic-based drug.
That can't be good.
No, it's not good. And you know, but the problem is it's the only drug that we have that will be effective, and it's been much better than it used to be. 30 years ago, we didn't have a product as safe and efficacious as this drug, but it requires a lot of care on the pet owner's part. You know, no exercise for 6 to 8 weeks after you treat. And why is that? Because you're actually killing these adult worms in the heart and the blood vessels. And if while they're being killed, if your dog's running around, you know, and chasing a frisbee or a ball, you know, those little fragments of worm can cause a blockage, and then the animal can die. So most of our reactions to heartworm treatment have to do with exercise and not with the drug itself. But putting that aside, it costs $1,000 or more to treat a dog. And it costs less than a Starbucks, you know, to prevent on a monthly basis.
And another reason why prevention is important in cats, there is no treatment. So it's either prevention or you have a real problem. Potentially, it could mean sudden death for a cat. More information on your website, that is?
It's www.heartwormsociety.org.
Remember that, for your heart's sake, or your pet's heart's sake, Heartworm Society. heartworm.org.